Now, for the next antiviral drug which we'll be discussing is what is known as etravirine. Okay, etravirine. Okay, so for the etravirine, I got it. We'll talk about this drug. So it's an antiretroviral drug. Okay, anytime you hear antiretroviral, it's actually used in treating HIV. Okay, so it's actually used in the treatment of HIV-1 infections, and it belongs to a class of drug known as the what? Non-nucleoside reverse transcriptase inhibitors. So they call them the NNRTIs. NNRTI. Okay, so how does these drugs work? They bind to the HIV-1 reverse transcriptase. That's an enzyme. Okay, and this will stop the enzyme from changing to a form, okay, that will make it active. Are you getting it? Like, it will stop some enzymes, when they want to become active, they change to a particular shape and all of that. So this will stop the enzyme from what? Changing. They call it will inhibit conformational changes. So this will now prevent what? The enzyme from doing its activity. What's the activity of the what? Reverse transcriptase? The activity is to turn viral RNA to DNA. So if you stop that activity, it will stop the virus from making other copies of itself. So that's what we got for this. Okay, so pharmacokinetics is usually given orally. It's highly protein bound, extensively metabolized in the liver. Excretion is mainly through the feces. Half-life is about 30 to 40 hours. Okay, so therapeutic uses is mainly used in treatment of what? HIV-1 infection in adults and also children, but these children must be more than 6 years. Okay, so it's always used in combination with other antiretroviral drugs. Okay, so in as much as it is effective, you always combine it with other drugs so that you further even make it more effective. So adverse effects can cause rashes, nausea, diarrhea, headaches. Okay, then serious ones can cause the Stevens-Johnson syndrome and a toxic epidermal necrolysis, okay, which are basically rare. Okay.